client's chest tube disconnected on the floor. What is the priority? A. Reconnect tubing. B. Notify provider. C. Place end of tube in sterile water. D. Cover site with gauze. Correct answer, C. Place end of tube in sterile water. Rationale: prevents air entry, avoids pneumothorax. Strategy: protect the system first. Question 26. A client with cirrhosis is vomiting blood. What is the priority? A. Obtain CBC. B. Insert NG tube. C. Maintain airway. D. Start 4 fluids. Correct answer, C. Maintain airway. Rationale: GI bleed plus vomiting blood, airway obstruction risk. Strategy: airway protection first. Question 27. A client with a spinal cord injury at T4 complains of pounding headache and sweating. First action? A. Check catheter for blockage. B. Give antihypertensives. C. Notify provider. D. Recheck blood pressure. Correct answer, A. Check catheter for blockage. Rationale: autonomic dysreflexia trigger must be removed first. Strategy: treat the cause, remove stimulus. Question 28. A client receiving morphine 4 has RR of 8. What is the priority? A. Notify provider. B. Stimulate the client. C. Administer naloxone. D. Check sedation scale. Correct answer, C. Administer naloxone. Rationale: respiratory depression is life-threatening. Strategy: RR below 10 naloxone. Question 29. A nurse notices the 4 site is red, swollen, and painful. Priority action? A. Slow the infusion rate. B. Apply warm compress. C. Stop the infusion. D. Elevate the extremity. Correct answer, C. Stop the infusion. Rationale: prevents further infiltration or phlebitis. Strategy: something wrong with 4, stop infusion. Question 30. A client with COPD has a new oxygen order of 6 liters per minute nasal cannula. What is the priority? A. Implement the order. B. Call the provider for clarification. C. Document oxygen use. D. Apply mask instead. Correct answer, B. Call the provider for clarification. Rationale: high O2 can suppress COPD respiratory drive. Strategy: question unsafe orders. Question 31. A client receiving chemotherapy has WBC1 200/mm superscript 3. Priority action? A. Educate on handwashing. B. Place in neutropenic precautions. C. Notify provider. D. Restrict visitors. Correct answer, B. Place in neutropenic precautions. Rationale: prevents infection in severe neutropenia. Strategy: immediate safety, implement precautions. Question 32. A nurse notes the chest tube dressing is saturated with blood. First action? A. Reinforce dressing. B. Notify provider. C. Change dressing. D. Check vital signs. Correct answer, D. Check vital signs. Rationale: determine hemodynamic stability. Strategy: assess before acting. Question 33. A client receiving 4 nitroprusside suddenly develops confusion. Priority? A. Slow the infusion. B. Notify provider. C. Check thiocyanate level. D. Assess blood pressure. Correct answer, D. Assess blood pressure. Rationale: nitroprusside can cause sudden hypotension, decreased perfusion. Strategy: ABC perfusion assessment. Question 34. A client with acute asthma attack stops wheezing and becomes drowsy. Priority? A. Give albuterol. B. Prepare for intubation. C. Check oxygen saturation. D. Notify provider. Correct answer, B. Prepare for intubation. Rationale: silent chest equals no air movement, impending respiratory failure. Strategy: life-threatening respiratory decline. Question 35. A diabetic client reports blurred vision and dizziness. What is the first action? A. Give snack. B. Check glucose level. C. Notify provider. D. Reassess in 15 minutes. Correct answer, B. Check glucose level. Rationale, hypoglycemia must be confirmed. Strategy, assess first. Question 36. A postoperative client has no urine output for 8 hours. Priority? A. Increase 4 fluids. B. Perform bladder scan. C. Notify provider. D. Palpate bladder. Correct answer, D. Palpate bladder. Rationale, quick assessment to determine retention. Strategy, least invasive assessment first. Question 37. A client with pneumonia is confused and restless. Priority? A. Reorient the client. B. Assess oxygen saturation. C. Give PRN anxiolytic. D. Notify the provider. Correct answer, B. Assess oxygen saturation. Rationale, confusion may indicate hypoxia. Strategy, ABC oxygen assessment. Question 38. A nurse hears a high-pressure alarm on a ventilator. First action? A. Call respiratory therapist. B. Check for kinks or obstructions. C. Silence the alarm. D. Suction the client. Correct answer, B. Check for kinks or obstructions. Rationale, most common cause of high-pressure alarm. Strategy, fix the simple things first. Question 39. A client with meningitis becomes increasingly drowsy. Priority? A. Reduce stimuli. B. Assess airway. C. Notify provider. D. Check temperature. Correct answer, B. Assess airway. Rationale, neurological decline threatens breathing. Strategy, ABC before neuroassessment. Question 40. A client with a cast reports numbness and severe pain unrelieved by medication. Priority? A. Apply ice. B. Elevate limb. C. Call provider. D. Assess pulses. Correct answer, D. Assess pulses. Rationale, suspected compartment syndrome, assess neurovascular status. Strategy, check circulation first. Question 41. A patient with a sodium level of 122 milliequivalent/L is confused. Priority action? A. Seizure precautions. B. Notify provider. C. Restrict fluids. D. Reassess sodium level. Correct answer, A. Seizure precautions. Rationale, severe hyponatremia, high seizure risk. Strategy, first prevent harm. Question 42. A client on digoxin reports nausea and visual halos. Priority? A. Withhold digoxin. B. Check digoxin level. C. Assess apical pulse. D. Notify provider. Correct answer, C. Assess apical pulse. Rationale, must assess heart rate before withholding. Strategy, assess, then act. Question 43. A client receiving blood begins to feel chills. Priority? A. Document. B. Slow infusion. C. Stop transfusion. D. Check temperature. Correct answer, C. Stop transfusion. Rationale, early transfusion reaction stop immediately. Strategy, transfusion issue stop blood. Question 44. A postpartum client suddenly develops chest pain and dyspnea. Priority? A. Assess oxygen saturation. B. Administer oxygen. C. Call rapid response. D. Check blood pressure. Correct answer, B. Administer oxygen. Rationale, suspected PE oxygenation first. Strategy, ABC. Question 45. A client with an NG tube has 900 milliliters green drainage in 2 hours. Priority? A. Clamp the tube. B. Check electrolyte levels. C. Reassess drainage rate. D. Notify provider. Correct answer, C. Reassess drainage rate. Rationale: confirm abnormal value before reporting. Strategy: assess first. Question 46. A client is anxious and hyperventilating. What is the first action? A. Give paper bag. B. Have client slow breathing. C. Assess oxygen saturation. D. Notify provider. Correct answer: C. Assess oxygen saturation. Rationale: must rule out hypoxia. Strategy: ABC oxygen assessment. Question 47. A client with heart failure gains 4 pounds in 24 hours. Priority: A. Administer diuretics. B. Assess lung sounds. C. Call provider. D. Restrict fluids. Correct answer: B. Assess lung sounds. Rationale: rapid weight gain, fluid overload, pulmonary edema risk. Strategy: assess respiratory status first. Question 48. A client on a PCA pump is difficult to arouse. First action? A. Stop PCA pump. B. Check oxygen saturation. C. Notify provider. D. Increase 4 fluids. Correct answer: B. Check oxygen saturation. Rationale: sedation, respiratory depression possible. Strategy: ABC oxygen check first. Question 49. A client with a pacemaker reports dizziness and near syncopal episode. Priority action? A. Notify the provider. B. Check apical pulse. C. Apply oxygen. D. Get ECG. Correct answer: B. Check apical pulse. Rationale: must determine pacemaker capture and cardiac output. Strategy: assess before acting. Question 50. Which client should the nurse assess first during shift change? A. Client requesting pain meds. B. Client with BG 198 mg per deciliter. C. Client with new onset slurred speech. D. Client awaiting discharge. Correct answer: C. Client with new onset slurred speech. Rationale: possible stroke, time sensitive emergency. Strategy: new neurodeficit equals top priority.